Hey everybody, I'm going to show you what order to put your PPE on. The proper name for this process is donning. That means to put on, okay? So the first thing you're going to do when you walk into clinic, of course, I hope you have your scrubs on, and then you want to have hair covering. Next thing you're going to do is grab your gown or your jacket. I already have mine here, so I'm going to put that on. Now it's time for your mask. All the cabinets at the end of the counters above the sink should have a box with masks and all different size gloves. So the mask is first. I like to have the color side out. This top portion has a wire in it so you can bend it. So I like to get it in a comfortable position. Most of the scrub caps and headbands now have buttons. That makes it more comfortable, so you can put these mask loops over the buttons instead of behind your ears, because that can get a little sore after a long day. You want to get your mask in a comfortable position, secure it on your nose. You don't have to pinch it too hard, okay? Mask, then eyewear. These are my magnification loupes. I am securing them to the back of my head, again, not too tight. I want to get my light in order now, because once I have my gloves on, I can't adjust my light. I can't touch anything else up here, otherwise I'm cross-contaminating. So I have my battery pack here. I'm turning on my light. I hold my hand out. I get my light in a nice position to where I can see clearly. Now it's time for gloves. Before you put your gloves on, you need to sanitize your hands. You can either use hand sanitizer, one pump, rub it in between your hands and between your fingers until your hands are dry. You may have to do this a little bit. Or you can wash your hands with soap and water for 40 to 60 seconds. You need to lather for. And dry. Make sure you thoroughly dry your hands. If you put your gloves on and your hands are not dry, then you can actually have some bacterial contamination occur in your gloves. And then you just want to make sure this counter is nice and dry. Now that my hands are clean, it's time to put on gloves. Usually while I'm putting on my PPE, I'm talking to my patient at the same time and just, getting to know them a little bit better or talking more about what I'm going to do next. When you put on your gloves, make sure that you try to extend the top portion of the glove so it covers the cuff on your lab coat. And now you're ready to get to work.